Hello, everyone. I am back from New York. Just got back this morning, and I want to give you some reports, some updates, answer a couple of the questions, and kind of kind of keep things. I think what's really important here are a lot from the standpoint of where this whole pandemic goes, what we could be doing on a few different levels. One, uh, how do we I want to make sure that everyone keeps safe. So the employees first, and we'll talk briefly about what everyone can be doing. And then as what we could be doing for our customers, making sure that we are able to support our customers in any way possible and the company as a whole. Let's just start with there's a couple questions I think on the our board here, but let me give you some updates. So in New York yesterday, I noticed there was a change in that people started talking about COVID and its impact, and that was not something I noticed the way I noticed it yesterday. I was walking around New York in the evening just to kind of get a sense of what was going on. So people are starting to really understand what's happening in New York. I had a few friends call me. I flew from New York into Detroit Airport this morning, and it was very concerning. The whole thing was concerning because when I got to Detroit, it was definitely quieter, but no one has implemented any public health measures, and that is very concerning. So at Detroit Airport, there are groups at security lines. There are groups walking everywhere, groups of people, and that's an issue. And we'll just touch on that very briefly in a moment. So I'm very concerned for a few things here, and we're going to talk about it. What my suggestions would be for the group here. So, as I started off, what I talked about in our first uh, video here, this is going to pass. This is going to be, life will return to normal at some point. It will. Just when is the issue, and at what cost. So, what can we be doing as what can we be doing as individuals right now? All of us. You know, you get just to put things in perspective. The there's two main things that we're thinking about here: the public health standpoint, of course, and also our individual health. Um, and what we do now needs to be extremely aggressive. So, in order to limit this spread throughout the country and the world, but your individual risk of one even getting the infection is still low on the lowish side. It may be increasing, but your overall rate of mortality is still very, very low right now. Okay, that's an important thing to think about. So how do we then take those stats right now and really dig in and make sure that they stay that way or even improve? And how do we as a group contribute to the elimination of this virus, or at least the mitigation of this virus? Okay, so I am going to ask that every one of us um, socially isolate or socially reduce um, our presence in public with any groups of people. So think about this: no concerts, no Anyone with a group, any place with a group, restaurants, any venue. Um, that is really the best thing that we could be doing as individuals and for the organization. Yeah. Now, limiting, socially isolating yourself or socially limiting yourself is a very difficult thing to do. And the reason why we do it, right, is to limit the spread, right? It's that if you're a 25-year-old, you're probably going to do fine if you get infected, statistically speaking. But the R naught here, the statistic of spread, one person spreading to 3 individuals. And as long as the spread continues, the mitigation is going to be very challenging here. And the issue is the healthcare facilities can't care for people. So when we get this big surge, I'm sure you guys have done some reading on this, but think about, there's water running in the sink and the water empties into the drain at a certain rate. And then all of a sudden you pour 1,000 gallons of water into that sink. There's no way that sink's drain is going to be able to handle that water, and it overflows. And that's what you'll see here, essentially. Instead, if I took the 1,000 gallons, though, and just dripped it in over time, just a slow pour as opposed to a big dump in the sink, it has a much different impact. So as far as what we can do and what we should be doing is we should be limiting our contact with groups of people. And we should presume that everyone, and I hate doing this because the whole fear factor here, and it's not about fear. There's nothing you have to be scared of here, but it's about doing our due diligence for public health, doing our due diligence. What can we contribute to reduce the spread of this virus? And that's by limiting our social interactions. I am pretty confident, and I'm seeing a lot today, but I'm confident this entire country will be on lockdown, schools, everything. We are following the path of Italy, unfortunately, simply because we still are not testing at the numbers that need to be tested, and we still have not implemented the measures that need to be implemented. And until we do that, things are only going to get worse. Unless you could always get a change in the virus, you could always get a change in the contagion, things commute, anything could happen. But in what we know now in our current state, where we're headed is take a look at what Italy looks like. And that's essentially where we're headed, because even to this day, people can't get tested at the rates that we need. So for yourself personally, right? First responsibility, keep yourself safe. Basic, you've heard all of this, but let's just be specific. You go out, or whatever it is, you have to go to the store. Fine, go to the store, pick out your few items, give the credit card, and pay for it. And then remember, during this time, you're not touching your face at all. Your mouth, your eyes, your nose, you're not doing any of that. And then whenever you can, as soon as possible, you wash your hands. Okay? So you need to wash your hands when you're out touching things that could have potential exposures, where there's people, right? Where people are sneezing and coughing, picking their nose and rubbing it on something. So we need to make sure you're doing that. And I think, right, that's the best you could do. That's the best we could do right now. Remove ourselves from the problem, isolate ourselves the best we can. And if we do have to go out, maybe we have to deliver meds to a loved one, or, there's going to be circumstances, and if that you have to actually go out and interact. If you do, you limit the groups, limit the contact, and be very, very mindful of what you're doing. with your hands and getting them clean and knowing who's around you. That's it, right? And that's the most you could ask of yourself. That's the most society could ask right now. And if we do that, if everyone does this, things are going to be just fine. And things are things are going to be okay. It's just at what cost are they going to be okay? All right. I also then want to just, as far as being safe, I think also you presume that everything shuts down. Everything. So think about that. If you're a parent or if you're caring for people, or whatever your kind of solar system is in your life, think about all the relationships, whether it's hobbies or other commitments. Think about the impact of that. All right. As far as just to answer a couple questions here, let's just go first to Destiny had a question. A 25-year-old friend who's had a fever and cough. She went to urgent care to get tested. However, she was sent home since they don't have enough tests. That is the reality right there. Um, people aren't getting tested. For someone in their 20s, 30s, and maybe 40s that has some of the symptoms, wouldn't it be best to stay home and recover? Absolutely, right? So, having symptoms, if you could just stay home, stay home. And you should tell everyone this, right? But what's important here, and this is where public health comes in, is that if you exposed other people, you will never know whether you had COVID or not. And those other people who've been exposed to you don't know if they are going to have COVID, and they are going to be interacting with people. Do you see the chain reaction that happens there? And that's why this infectivity, contagious rate is three people, 4 people, 5 people for every infection. So I would say this though, given that testing is so limited right now, and if you're healthy and you're relatively isolated, if you have a partner, small family, something like that, absolutely, you're symptomatic, you just sit tight, stay home, okay? Keep washing your hands, cough in your arm, and those that share a house with you need to be very cautious. At the first symptom, they need to isolate themselves too. And that symptom may be body aches, tiredness, cough, fever. Little sore throat, runny nose is unlikely to be COVID, but could be. But they would need to isolate as well, since they would have a potential contact. So hopefully that answers that. And to stay home and recover, what does that look like? Well, for the majority of cases, people recover. All right. That's important to note here. The majority of cases, people are recovering. The far majority. It's just like it's rest, fluids, Motrin, Tylenol. However, if you start getting shortness of breath, you're going to need to seek medical attention for sure. Okay. As far as the next question about schools closing, great question, Sarah and Morgan. Here's the deal. Data is pretty strong right now. 8 years and younger, there's been no deaths. Kids seem to be navigating this really well. And kids looks like most kids are doing pretty well here. But as we know, that's not the issue. That's a good thing, right? But the issue is, are kids infective? Are kids carriers? Are kids transmitting the virus? Are they the silent carriers here? And that's a very real issue and a very concerning question. So if you have millions of kids around the world, around the country, going to school, a certain percent are going to be infected, a certain percent are going to take that virus, and a certain percent are going to transmit that virus to people who think they're otherwise safe. You could limit that by, again, good hygiene, good hygienic measures. All right. Does that mean you're not going to kiss your kids goodnight or hug them? But that will be extremely difficult to prevent, right? So you want to take the right measures. Obviously, yeah. So there's the public health question. The public health answer, I believe, is schools should be closed. That causes a secondary effect that is significant, enormous. And by the way, I've just washed my hands. Like I was going to do an appendectomy. I washed them so well. So that's why I just touched my face and nose. But if you touch your nose, use an area that you don't touch things on. All right. So schools are ultimately going to be canceled. I've been confident about that for a while. And I think we're seeing that. Religious schools, private schools, public schools, they're going to be canceled for at least through March. Hopefully they could get back in April as things slow down a little, but that's certainly the case. The other thing I think you should all plan for, and I just say this as just an insight, it's not health related necessarily, but presume everything shuts down. I've told my father, who still works, that presume that his job goes away. The economic implications here are deep and enormous. We have never I've tried to think about another time in our last 100 years, 150 years, even more, that we will have experienced what we're about to experience. The entire world will be running at a much lower capacity, and much of the highest producing or most active economies will be shut down. America, Europe, China, East Asia, they are shutting down. And those are going to be lasting impacts. So from the economic standpoint, it's real. It's real for our company too, by the way. And one thing I do want to touch on is we should be very conscious of this. We are not immune as a company. We are not immune to what's happening. In fact, we are the opposite, right? We are certainly at risk, just like a lot of people out there. And so that means I would think about conservation of food, of money, of everything. This is a good time to practice essentialism. And until we know more information, right? This could all get better in 3, 4, 5 weeks. It's possible, right? Maybe a month. Maybe this all gets better and things get back to normal. But be really thoughtful of the downstream effects here, of the secondary and tertiary effects that we will see. As a company, we need to stick to our core values. It always comes back to our core values. There is no doubt in my mind that we are going to go under some stress here. I suspect that the healthcare system will be overwhelmed, and that programs, will be stressed in many ways. And how that impacts us is unknown right now. So our core value is we build a human connection, we go one step further, we pay attention to detail, and we continue to do that. We continue to produce the best possible product, but we also think about ways to eliminate waste, to become more efficient, to work with less, and to think about the needs of our customers and how do we connect with our customers to be able to provide them what they need. And that's what we should be doing right now, our day-to-day work, and then these other areas in this new environment that we're in. How do we connect with our customers and provide them what we need? Everyone needs to be on the same page with that. And that page is making sure that we are working as lean as possible. Make sure that we are working as efficiently as possible. Presume all conferences are canceled. I'm pretty sure that will be the case. All conferences are going to be canceled in March, April, and I suspect May as well. That means all marketing, hard copy marketing, and that means we need to think about what we're going to do with to reach an audience that needs our product or that could benefit from our product, and how we could provide that to them. Think about these things. That means that we're going to be definitely working from home more, right? Hopefully, you guys will be limiting any travel, staying at home, and thinking about how you could be productive there. So I'll leave it at that for now. I would love any feedback that you have or any other questions that you have, specifics. I'm constantly monitoring and speaking with people on the ground to get the real information of what's going on out there. I think this is a good time where you could really, grow in other ways where life is going to slow down a little, and that's not necessarily a bad thing. It's going to slow down for many people. It's going to be really hard for others, though, and we should all be aware of that. This is a moment. This will be a moment just like 9/11. If those who were alive for that, because I know some of you were not, or you're very, very young, this is a 9/11 moment. And right now, the big difference is we only have ourselves to support one another here. It may change, but our federal government, the messaging coming out of there is the opposite of what we need from the public health standpoint and from a societal standpoint. But I have faith in the American people. I have faith in everyone here, right? And it's just groups of this. I just got off a call with our local religious community, and everyone is taking a leadership role by shutting down their meetings, their prayer sessions. Everything's getting shut down, and we have public leaders, and these are the people who are going to lead us. And everyone here is a leader, right? You all have friends and family. You need to send the message: stay home, stay away from groups. And the more and more people that do this, we're going to get over this quickly, or quicker, and at a lower cost. All right. Good time to just reflect, journal, talk to loved ones. Video chat is working just fine right now. So, talk to people by a computer that you haven't seen. Now that you have a good excuse, you're not going to go see them anyway. So give them a ring by video, and think about what you could do for yourselves, what you could do for society, and then what you could do for Rosh of you. As far as how can we just be there for support? How can we do what we do best and apply that in this setting? So I'll leave you with that, and always more to come. Okay, and yeah. All right. Thank you for your time, and we will talk soon.